Hello, this is Scott Soretta, Director of Education for the COPD Foundation. Today we're going to talk to you about the educational materials that are available through the COPD Foundation. The first thing I'd like to do is point out that on this video webinar, you will notice that in the lower right-hand corner of the video, there are 3 dots with 3 bars. This is a table of contents. Please open up that and click that button now. And what you'll find is on the left side of your video screen, you will find a table of contents. In the future, you can go back to this video tutorial, and rather than going through the entire thing, you can click on a specific educational material that you would like to learn quick and easy information, and you can go right to that slide in here, that section of the presentation. So let's go ahead and get started. The purpose of this educational video is to discuss our copyright rules and options for ordering educational materials. We're also going to describe the educational materials that are available for distribution by volunteers and COPD staff at our conferences and awareness events that we typically attend. This video tutorial will also be a great resource for describing educational materials for healthcare professionals who are considering to order some of our educational materials through the online catalog. So this tutorial will look at each piece that we produce. I'll talk about how they're commonly used and the best way to use them within your organization. And then you can go to the catalog and order those in bulk, and we'll send those out to you. So let's start with our copyright rules. Our copyright rules are available on our website for download and viewing. All of our educational materials are protected by copyright rules and regulations. However, we do allow for local printing for personal use. We also do not allow any sort of modification, deletion, addition to the material, or a changing of the file structure to degrade the content in order to put it into your own platforms like healthcare record systems and so forth. We also require that all the educational materials be printed from cover to cover in their entirety. The only exception to this would be the Big Fat Reference Guide, which is a 400-page manual, and we do encourage single-page printing from the BFRG. We also discourage any photocopying of our products. Please don't use copier machines. We provide access to you to get the high quality electronic files. We encourage you to print directly from those files. And if you would like to see more information about our copyright rules and restrictions, you can go down here to this link, and it will take you directly to this page you see here on the right. If you have any questions about copyright rules, please contact Scott Soretta. So for ordering materials, there are several different ways, and I want to describe what our ordering process looks like. Those individuals living with COPD or impacted by COPD, whether they're family members or caregivers, may call our COPD information line. We'll provide you with free educational materials and free shipping to a single address. We also have materials available for electronic download from our website. This is the least expensive method of getting access to our educational materials, and we highly encourage the electronic files to be used. These are for personal use, and you can go directly to this materials brochures page. You'll be required to register one time for our site in order to get access to the educational materials for download. Another method of ordering is reserved specifically for healthcare professionals. Healthcare professionals will get access to free educational materials, but we do require you to pay shipping fees to get the materials to your location. We started this about 1 year ago, and the purpose was to keep our educational materials under control cost-wise so that we can reserve the free shipping and distribution to the people who need it most, which are our patients. So those healthcare professionals who are handing and reaching out to the patients, we would like you to use the materials, but remember, if you are not able to pay for the shipping, you can always send your patients directly to the COPD information line to order them directly from us. Our online catalog requires a one-time registration as a registrant, and you can go to this link to sign up for our catalog. You can shop like a regular catalog, put things in your basket, and you'll get a shipping total before you check out. Other ways of ordering materials. We will waive shipping fees for healthcare professionals if you have a specific event. We require you to contact Jane or myself, and what we'd like to do is know more about your event. We'll also promote your event by sharing it on our website and our calendar, and we also encourage you to take any photographs, get waivers and photo release forms of anybody in the photos, and we would love to put that on our social media to show the impact of you and your event in your local area. So for you sharing the information like how much you ordered and how many people came to your event, we will waive the shipping fees for those purposes. We highly encourage you to take advantage of that, and we do appreciate you assisting us with raising awareness for COPD. Another exception is the Pulmonary Education Program. Members of the Pulmonary Education Program will get free shipping for all their materials, including the PEP materials as well as additional materials that PEP members may order for other parts of their hospital. So if you'd like to learn more about the PEP program, please click this link below. And PEP programs are designed specifically for pulmonary rehabilitation or outpatient centers. So I wanted to talk a little bit more about our Copyright Rules Exhibit A. So if you just watched those last couple of slides and you had some questions, or if your use goes outside of our regular copyright permission rules, these rules would apply. So translated materials are not available in print. They're only available in electronic format. We also have a large volume restriction, so depending on the cost of the item, we will put quantity limits for those orders. And the Exhibit A will describe how we decide to limit the quantities. So we reserve, obviously, a lower quantity for our high-cost items, like the Slim Skinny reference guides. We also will encourage you to contact us if you want to do a collaborative print project, and we explain what that is in the Exhibit A rules. So collaborative print project, we're often approached by other hospital systems who would like to distribute our materials, but they want to put their logo on it. We would have to send that to our designers. We would have to implement and add your logos to it, and we would charge a one-time flat fee of $600 for that. And we will provide you and your organization with a high-resolution printer CD files. So, for example, one of our common products that are requested is the Slim Skinny reference guides. They come at a high cost. We put a limit on of 25. So the high resolution printer CD would be the best option, and then you can just print the nutrition guides for your nutritionists to hand out. You can print the guide on medications for your pharmacist. So you have more advantages by ordering those directly from us, and we're happy to do a print acknowledgement on those educational materials. If you have any questions about our purchasing options or additional information about Exhibit A, please contact me and I'd be happy to talk to you about our options. So the educational materials throughout the rest of this tutorial will be broken up into 4 categories. Patient educational materials, healthcare provider educational materials, our materials directly related to the Drive for COPD campaign, and then we'll talk about some promotional materials and publications. The promotional materials are some of our flyers and things that we typically use for staff members or volunteers that attend one of the conferences attended by the COPD Foundation. So let's first start off with our patient educational materials. The patient kit includes many items that are stuffed into this pocket folder. The most common application for the patient kit is when a customer calls the information line. We will send out this packet which has a broad range of foundation materials. These kits do come at a high cost, and their limit is $25. They're ordered through our catalog with the unit of measure set at each. And then we often will send patient kits to healthcare professionals before they make an order. So this is another common use of the patient kit. The What's of COPD is a very common brochure. In fact, the most common use for this is a doctor's office, a drop box, a clinic, a pulmonary rehab center, a respiratory care department. This would go in the outside in a little drop box, and it gives somebody the nuts and bolts about COPD. What is it, and what should I do if I think I'm at risk? This is a 6-panel trifold brochure in a 4x9-inch format. There's a limit quantity of 1,000, and they come in packages of 25. So when you order these in our online catalog, the minimum quantity you can order is 1 package, which will give you 25 pieces. So if we look at this brochure, the inside cover talks about the causes and symptoms. The next panel will show you about what should you do next. This is also a brochure we frequently use at our screening and awareness events. If you're hosting an event in your area raising attention for COPD, we want you to use this. We talk about the national statistics, we raise awareness and let people know that if they think they're at risk for COPD, they should blow into a spirometer to measure lung function. The back panels include the what is COPD definition, and lastly is information to contact the COPD information line. The next educational material we offer is the 1s, 2s, and 3s of COPD. This is an extremely popular piece. It comes at a slightly higher cost. It's a 24-page booklet, but it's available as a 6x9 in dual languages. So one side will have 24 pages in English, and the flip side will have 24 pages in additional language. We include 9 additional languages in addition to English. Again, the translated materials will only be available for electronic download, and we will have some printed materials available at the conferences only attended by COPD Foundation staff members. There is a limit of 500 and PDFs are available. These would be ordered as each. In this booklet, what you'll find information to educate the patient on how to learn more about COPD. We empower the patient by talking about living with COPD. And then we engage the person living with COPD to let them know ways that they can advocate for themselves. The best application for this is the material I really like to use for the newly diagnosed individual, the person who is in the hospital getting discharged. So this is a piece we highly recommend for healthcare professionals to order in bulk. So let's take a look at the additional covers. We also include 9 additional languages, including Arabic, Chinese, French, German, Hindi, Italian, Japanese, Portuguese, and lastly, we include Spanish. The next educational material is one of our most popular. It's called the Slim Skinny Reference Guide. This comes in a set of 10 different booklets covering 10 of the most salient topics from the Big Fat Reference Guide. The Big Fat Reference Guide is not for daily reading. It's a reference guide with a 400-page manual. The Slim Skinny booklets are a 6x9 booklet, 12 to 16 pages each, and there's 10 different topics per set. The unit of measure for ordering is you'll get 1 set of 10 booklets. This is a high-cost educational material, and we set a limit of 25. If you would like to get printed copies for your patients, we would encourage you to have your patients call our information line directly, and we would be happy to send those out to them in printed format. The other option is for you to use our downloadable PDFs. Encourage patients to use these, or you can also do local printing at your institution from those downloadable PDFs in a small quantity. This is also one of the key educational materials that we have translated in 9 additional languages, and we also want to highly encourage you to know that more is coming soon. We're currently working on a hospitalizations and transition back to home, SSRG, and as well as a disaster preparedness guide. We're also working on a smoking cessation and a caring for caregivers guide. But the next 9 I slide through will show the different languages as well as the different topics. So this is Arabic. Then we have Chinese, French, German, Hindi, Italian, Japanese, Portuguese, and Spanish. The next educational material is the Big Fat Reference Guide. This is a 400-page booklet on living well with COPD. This is not for your daily reading. This is more of a reference manual. While it is written for patients in mind, this is an excellent resource for healthcare professionals to know about. This is also one of the exceptions to our copyright rules where you do not need to print this in entirety. We do encourage individual page or chapter printing from the Big Fat Reference Guide. And this reference guide is broken up into two sections. Section A covers managing your health, and Section B covers managing your disease, which is specific chapters on living well and managing COPD. This reference guide also includes a glossary, appendix with additional tables, the COPD assessment test. This is not available in print form. This is only available for PDF electronic download from our website. We're currently working on a website book, so all 10 languages will be in addition to the downloadable PDFs. It will also be available by web book as well. And I want to highly encourage people to download these files and to let you know that we are no longer distributing the Big Fat Reference Guide CDs. We have instead replaced it with our downloadable PDFs, which are the exact same file that was located on the CD. So let's take a look at the additional materials we have. This one is in English. We also have Arabic. We also have Chinese, French, German, Hindi, Italian, Japanese, Portuguese, and Spanish are available. Most of these are available right now up on our website for download in all 10 languages. The next educational material is the Impact of Smoking chart. The Impact of Smoking chart is an 8x10 dual printed brochure. It is English on one side and Spanish on the flip side. These are available in high quantities of 1,000. They're also available for electronic PDF download. We also have this available in Spanish on the backside cover. The next fact sheet we offer is the What is COPD? This covers the basic information about COPD statistics, facts, and also the burden of COPD in the United States. This is available as an 8x10. It's great for drop boxes in doctor's offices, clinic, respiratory care department, pulmonary rehab centers. And this is also available as a unit of measure each with a limit of 1,000, also available for electronic download. English and Spanish. The next patient educational material is a flyer. This is an 8.5 by 11. This talks about patients being at risk for alpha-1 antitrypsin deficiency. The COPD Foundation recommendation is that all individuals diagnosed with COPD be tested. This is a simple blood test and it's the only way to know if you have alpha-1 related COPD. It's important that we find and test all individuals living with COPD because there is special treatment available for those that have alpha-1 related COPD. These are available in bulk. You can order up to 1,000. Quantity is each. The next series of educational materials is our healthcare professional materials. We're going to start off with our HCP kit. So this kit is very similar to the patient kit, but it includes a couple of different pieces that are specific for healthcare professionals, including the professional version of the Alpha-1 flyer I just described. It also includes the Lung Health Professional magazine in place of the COPD Digest. And then many of the other materials are the same as well. One other unique piece I want to point out for healthcare professionals, we have the 6-panel pocket consulting guide talking about COPD treatment and a therapy chart. We often use them as sample packs for healthcare organizations to decide what materials they want to use. And if you do receive one of these packets, it's important to know that you can order each of these individual items. You don't have to order a kit to get them all. Next up is the DME kit, Durable Medical Equipment Kit. We produce a similar kit. In fact, the contents are identical to what a patient kit is. The difference is the cover letter. We will distribute these sample packets in a limit of 200 to DME companies. And we changed the cover letter so that this is a special cover letter that says the COPD Foundation and the home care company care about you and your health. If you have questions or needs about your durable medical equipment, please contact Home Care Company. If you would like to learn more about managing the disease, please contact the COPD Foundation. Next up is the COPD Pocket Consultant Guide. The best application for this is for healthcare professionals, physicians, pulmonologists, nurse practitioners, physician's assistants, and allied health professionals having conversations with patients talking about the severity domains for treatment and management of COPD. So this is a tool specifically for them, and it's available in a 4x6 tri-fold 6-panel card. This easily fits into a pocket or a lab coat. These are available in a quantity of 50, so there's 50 items per package. These are also available for electronic download PDF files. So the new COPD Foundation Guide to COPD Diagnosis and Treatment talks about 7 severity domains: spirometry grades, regular symptoms, exacerbations, oxygenation, emphysema, chronic bronchitis, and comorbidities all have implications for treatment. The treatment therapy chart can be seen on the next panel, which lists the severity domains in the rows located here, and the recommended treatment and therapy is listed in the columns. It gives recommendations for first line and second line and possible other options. So this really is a great card, and it's available in several different versions. There's a generic name version, which is shown here, which the medication table uses generic names, which is most common with pulmonologists and academic centers. The trade name version is more common for allied health professionals, primary care, and those who are having direct conversations with patients, using the terms that patients are most comfortable and familiar with when it comes to taking their medications, which are often the trade name of the drugs. We also have our online community for healthcare professionals to discuss the treatment guide, and then your comments and questions will shape future editions of the COPD Pocket Consultant Guide. So taking a look at the other panels here, we have the medication panels. There's 2 listing all medications commonly used for COPD. We also have the COPD assessment test, which is an 8-question questionnaire assessing health status for individuals with COPD, as well as the MMRC, another common breathlessness scale that is used to gauge symptoms. We also give recommendations for smoking cessation and counseling. And I want to point out to those staff members and volunteers that work at our conferences, we commonly have 3 different versions of these cards available at the table. We have the 6-panel generic, 6-panel trade name, and the 2-panel version. The only difference between the generic name and trade name version are these 2 inside panels, where one lists generic and the other lists trade name. The other quick way to identify the difference between the 2 is on the back cover. The New York Presbyterian Healthcare System logo is on the generic version, and it is not on the trade name version. Next up is the Pocket Consultant Guide 2-panel version. This is a more compact version, very good for somebody who just wants to know the spirometry domains and the recommended therapies, and they don't typically need access of the medications because they're quite familiar with it. So this version is also available 4x6, same physical size, 2-panel. You just flip it over for the back therapy chart. And the limit for this is 1,000. They come in quantity packages of 50. No medications are listed on this table, and there are no symptom scales on this chart. If we take a look at the other side, you see that same therapy chart, which lists severity domains into the rows, and the common treatments for COPD is listed in the top columns. The next version is our poster. The posters are commonly used in offices, clinics, respiratory care departments, academic centers. These are very common in clinic rooms where healthcare professionals can have conversations with their patients by doing spirometry and diagnosing COPD. They can show them where they belong on this therapy chart, and they can show them where they belong in the guide for treatment, first line, second line therapy. These come in packages of 10. There's a limit of 100 packages per order. And these are 18-inch by 22-inch, and they're 2-panel. Front and back side are printed. This is what it looks like on the back side. Next up is the COPD assessment test. This is the questionnaire that is used for health status. This is very commonly used in pulmonary rehab centers, doctors' offices and clinics, respiratory care departments when you're assessing patient health status. It's based on 8 questions. And unlike the breathlessness scale, it doesn't just look at breathlessness. This looks more at quality of life measures. These are available as an 8.5 by 11. They come on a pad of 25. If you would like to learn more about the COPD assessment test, we give you a direct link to the user's guide, which tells you what the instrument means, how it was validated, and what to do with certain scores. Based on our Pocket Consultant card and our COPD Pocket Consultant app, we use a cutoff score of 10 or more to indicate more significant symptoms. Next up is a healthcare professional material called the COPD Digest Prescription Pad. So this looks and has a similar feel to a prescription pad. The best application for this is in a pulmonology office, a doctor's office, or a pulmonary rehab or respiratory care department. If a patient has COPD and they have questions about COPD and need to learn more, you can tear off one of these sheets. They come in a pad of 100. It's a 4-inch by 3-inch pad, about a 1/2 inch thick, and then you can quickly give them information to contact the COPD Foundation information line. Next up is the impact of smoking poster. This is similar to the small 8 by 10s, but this is designed specifically for the rehab centers, doctors' offices, where you can post them up on the walls. It's dual-sided print, just like the small card, where you have English on one side and Spanish on the other. But this is much larger. It's 18-inch by 22-inch. It's the same size as the Pocket Consultant Guide posters. So we typically at conferences will roll those 3 pieces together with a rubber band, and we'll send them off with people at the conferences. We encourage people to come back to our website and you can order these. These come in a package set at 25 pieces per package. That's the minimum order that can be for the posters. So this shows the loss of lung function over time and the benefits of quitting tobacco. English on one side, and we see Spanish on the opposite side. The What is COPD fact sheet is the same format. It's a poster, 18-inch by 22-inch, commonly used in offices and clinics. There is a fixed limit of 100 packages of 25. Minimum quantity ordered is 1 package. You will get 25 pieces. This is a dual-sided print where we cover COPD facts, statistics, and the burden of COPD in the United States in English on one side, and we include Spanish on the flip side. Next up is the Alpha One Healthcare Professional Flyer. So this is targeted directly for the healthcare professionals. We commonly distribute this at conferences and COPD Foundation staffed events. This is an 8.5 by 11 sheet. It comes with the limit of 1,000 and they're ordered individually. Next up is our third series of educational materials I wanted to discuss. This is the Drive for COPD campaign materials. Any questions regarding the materials, the promotional pieces, limitations or restrictions can be discussed with Jason. I'm just going to briefly discuss the materials that can be ordered through our online catalog. So first up, I want to discuss the campaign, Drive for COPD, and this pinwheel. It's the iconic symbol that represents the 15 million Americans who have COPD and they don't have the breath to blow and spin a pinwheel. It also represents the other 12 million Americans who have COPD and don't know it yet. So we encourage screening 5 basic questions about you and your lungs. It takes less than a couple minutes to do. I also want to point out that this is a national campaign for the United States. There are restrictions for distributing the materials internationally as well as the promotional materials. So they're only available in the United States, and there are restrictions on who we can supply these to. So again, Jason is your point of contact for those specific restrictions for quantities and the types of organizations that would qualify to receive these materials. I also want to point out that these materials will be shipped from a separate warehouse. So if you order materials from our online catalog, you order some foundation materials and some drive materials, they will come separately in 2 different shipments. If you would like more information, please visit our website or contact Jason Mori. So next, let's take a look at the specific materials we have available in the Drive for COPD campaign, commonly used for awareness events that healthcare professionals will want to host or that the foundation will host in a national campaign. So the best application for these are screening events. This is a simple fact sheet. It's 8.5 by 11. They come in a quantity of each. There are special program restrictions, and this is part of our event screening that we have for the Drive for COPD campaign and screening events. Next up is the population screener. The actual screeners that you will be ordering are an 8-panel, 4-inch by 9-inch brochure. You will open it up, and inside you would see this screener questionnaire asking 5 basic questions about you and your lungs. Those individuals who score 5 or more are greater risk for COPD, and they should talk to their doctor about the symptoms or blow into a spirometer and check their lung function. So the information is displayed here, and it's also on our website. We highly encourage you to talk to others about getting screened and send them to do an online screener as well. You don't necessarily need to do a paper screener. Next up is the COPD personal scorecard. This is commonly used at screening events where we're performing on-site spirometry. Some organizations may be doing your own awareness event where you bring your respiratory care department out and you're doing your own spirometry on site. So this form would be very useful for you. And on the front side, it includes the basic information about the population score screen, some information for the staff that are working the awareness event to be aware of, and then locations to put down the results of the spirometry test and any therapist notes. On the back side, what you'll notice is this is a takeaway. So you give it to the patient so that these results can be shared with their doctor. It gives basic information about COPD and really encourages the individual to continue that conversation in the doctor's office. These scorecards come in color, 8.5 by 11. They're 2-sided, and they come in a tear-off pad. So you order 1 pad of 25, and you can use these at special events. Next up are a couple promotional items which are typically used at awareness events. This is a toy car. The physical side is 3-inch by 1-inch by 1-inch. They're ordered in each. Again, special program restrictions do apply. And when you order these through our online catalog, the purpose of this is for bulk ordering. This is not for somebody who wants 2 or 3 cars for their children or for somebody they know at risk for COPD. This is bulk ordering giveaways to get people to come to your booth so you can help raise awareness for COPD by giving away some of these promotional items. Next up is the bracelet. This bracelet is made from recycled car tires. It comes in a 4-inch by 3-inch wrapped document that talks a little bit about the pinwheel promise on the back side. These bracelets have a little symbol on the other side. This is the clasp, but it shows Drive for COPD. It's a great little giveaway awareness events to get people over to your booth. Next up is the pinwheel magnet. This is a magnet that can go on a refrigerator or on your car. It's 4-inch by 4-inch, and on the back side it talks about the pinwheel promise. If you contact or reach somebody at risk for COPD or do an awareness event, we encourage them to take part of the pinwheel promise. By taking action today, one can get help to breathe better tomorrow. We highly encourage you to pass on this pinwheel promise and talk to 4 other people you know who may be at risk for COPD. Get them to take the simple 5-question questionnaire that you did at the event, or send them to the online questionnaire and check their screening risk factors. Next up is the pinwheel pin. These are small 3/4 inch pins that are used on the lapel or on clothing. It's our awareness symbol representing the 15 million Americans who have COPD and don't know it yet. We typically will hand these out at conferences and events. Again, special restrictions do apply. Next up is the COPD Foundation Information Line Feather Card, we commonly call this. And this is an information card to get patients direct access to the COPD Foundation Information Line. This is a 4x6 bifold card that has English and Spanish. The COPD Foundation Information Line is a call center. They perform inbound and outbound calls, and they're open from Monday to Friday, 9 a.m. to 9 p.m. They provide peer-level support. They don't provide medical advice, but they give patients love, attention, and point them to the resources to better understand COPD and how to best manage it. The true beauty of the COPD information line is that it's staffed by individuals living with COPD or those impacted by COPD, like family members and caregivers. The COPD information line is a powerful tool that we have at the COPD Foundation. This card is commonly used in many audiences, at patient events, healthcare professional events, also at other events and trade shows that are staffed by the COPD Foundation. So if we look at the 4 covers, this is the front cover here in English with the telephone. And then on the inside panel, we have the direct phone number for the COPD Foundation information line, as well as in Spanish, and then the back cover. Next up is the promotional flyer for educational material download. This is the flyer that's actually replacing the Big Fat Reference Guide CD. This flyer will be available in an 8.5 by 11. It's in production now. This is just a screenshot of our downloads page, but the flyer will direct customers with a QR scannable code to this website. There's a limit of 1,000. It's ordered in each, and this is a promotional material commonly that will be used any place we use the Big Fat Reference Guides. So patient events, healthcare professional events, all events, this will be commonly used. And our Big Fat Reference Guide, the reason why we no longer carry the CD is because all the information on the CD, the exact files, are now located as downloadable PDFs from our website. But in addition to English, we offer 9 additional languages. Anytime we make a change to the material, we can quickly update the website. So this really is the go-to place versus using the CD, which was more difficult and more expensive to update on a regular basis. Next up is the COPD registry brochure. The best use for this is to let patients know that they can get involved with COPD research by connecting them to researchers. This is a 4x9 6-panel trifold card. There's a limit of 1,000. These are commonly used at multiple events as well. They're ordered in a quantity of each. You can also contact the information line by accessing this brochure to ask for a registry kit. The registry kit is the kit that the patients will fill out the information to enroll in the registry. The benefit of the registry is the patients have full confidentiality and they get to pick and choose the research options that are available for them. So patients always have control and they always get to choose. If it's a study they're not interested in participating in, then they do not have to. The other true benefit is that all cost of health care are completely covered if they are enrolled in a research project. So if we take a look at the 6 panels, we see the inside panel that talks about what is COPD, what is the registry, and who's eligible to enroll in that registry. We also discuss enrollment steps, as well as who will have access to the name and the confidential database, which we do in conjunction with National Jewish Health Center in Denver, Colorado. And then last is the back to panels, which is how can my participation help promote research? Again, we are looking for a cure of COPD. It's one of the main missions of the COPD Foundation. Next up is a PEP brochure. This is the Pulmonary Education Program, a new program of the COPD Foundation. This is a two-sided brochure commonly used at trade shows that COPD staff will attend, and more specifically to events that cater towards pulmonary rehabilitation centers. This is a 4x9 two-sided card, and these come in packages of 25 with a limit of 25 packages. It gives information about the PEP program, talks about recruitment and the benefit. If you'd like to learn more about the PEP program, please contact Jane Martin or Scott Soretta or visit our website that gives more information. Next up is a Register to Win card. This is also a card commonly used at COPD Foundation staff events where staff or volunteers will be attending. We will commonly use this, and the best application is when we don't have a barcode scanner. So we can get individuals, either patients or healthcare professionals at the events who would like to register for a COPD digest and our monthly e-newsletter. They can complete this card. We'll collect their information. We'll put them in our database to receive the digest and e-newsletter, as well as the lung health professional for those that are medical professionals. And we will do a quarterly drawing. So for staff that are collecting these cards at the end of the event or volunteers, you'll need to mail those to the Miami office. Next up is another promotional item for COPD Foundation staff events or volunteers only as well. And this is an 18-inch by 22-inch poster of the Guide to COPD Diagnosis. It's the same two-panel poster for the Pocket Consultant Guide that you have seen previously, but the difference is this is mounted to a foam board. It is rigid and stiff, and it's used for events where we have healthcare professionals in attendance so that we can show them the front and back side of this to really explain the therapy chart and the 7 severity domains. These are limited to 1 or 2 only per event, and then we typically give it away to a local person who has the ability to take this back to their institution. This is the back panel highlighting the therapy chart. Next up is the Pocket Consultant Guide Institutional Pack, another item that is used at COPD Foundation events, primarily that have a healthcare professional audience. The best application for this is to promote bulk quantity ordering of the Pocket Consultant Guides. If you interact with a healthcare professional or doctor who wants to take this back to their institution and try to get large quantities of the Pocket Consultant printed cards out to their community, this is the best thing to order, the institutional pack. It is two-sided, 8.5 by 11-inch flyer. Limited is 1,000. They're ordered in a quantity of each. We promote not only the Pocket Consultant card, but we'll also get a choice of if they want 6-panel cards, generic or trade name, and then what quantity, a small, medium, or large quantity can be ordered, and then they get a corresponding number of posters as well. We also, in this kit, will provide them with a published manuscript of the COPD Foundation guidelines, as well as a PowerPoint presentation for grand round presentations at their institution, suggestions and tips for how to disseminate the pocket cards at their institution, and the mobile app flyer will be available in bulk quantity for them to hand out and promote the use of the mobile app as well. On the back side, if you're at the event, this is for staff. Rather than have somebody mail this back to you, you can flip it over and collect what that individual wants, put their name at the bottom and collect the billing address. And then at the end of the event, you'll need to scan and send this over to Scott Soretta. He will fulfill the order and get the institutional pack out to the institution. The PowerPoint presentation and published manuscript will be sent by email. So please do make sure that you collect the email address. Next up is the COPD Pocket Consultant app. It will be available on September 7th. 2013, and you can see there's a barcode here that will take them to a page of our website where the downloadable app button will be located. We also will be launching a COPD community. The community site is where we have healthcare professionals talk and discuss the COPD Pocket Consultant Guide app. And the discussions that are generated from this community will be used to publish future editions and versions of the app as well as the printed cards. Next up is the translated patient materials. This is the flyer we typically use in international conferences or conferences where we have a large international presence. We typically will have a few of the printed translated pieces, but these translated materials are not available for large distribution and print. Instead, what we do is we encourage people to take a flyer and they can scan this QR code and go directly to our downloads page where they can get access to 9 additional languages in addition to English for the 1, 2, 3s of COPD, the Slim Skinny reference guides, and the Big Fat Reference Guide downloadable PDFs are all available on our website. This is the best way we encourage promotion of our translated materials. If anybody is in an international audience and they would like to get printed copies, that would be part of Exhibit A for our copyright rules and regulations. The most cost-effective option is the purchase of a one-time printer CD with those files that they can do local printing, and we can avoid the high cost of international shipping. Next up is the online catalog. This is the most common thing that I try to promote and distribute at healthcare professional events. This is a flyer. It's 8.5 by 11. Limit is 1,000. And the best use is when we talk about our educational materials. We give out a few samples, but many people, especially healthcare professionals, don't like to take a lot of things home. So we encourage them to take a flyer. They can scan it and go to our downloads page, or they can go directly to our online catalog where they can order all of the educational materials that they choose to use. All of our educational materials on that catalog are available free of charge. Shipping fees do apply. There are also limitations to the quantities that apply as well. Next up is the promotional flyer called the DME or Digest flyer. Many times at healthcare professional events as well as patient events, our staff and volunteers will interact with other vendors. And oftentimes the vendors will ask us how they can get involved or how they can advertise their products within the foundation resources. And the best way to do it is to have a print ad in the COPD Digest or Lung Health Professional magazine. The other thing that we promote in this flyer is the DME kits. Those DME kits we explained earlier. Durable medical equipment companies will often be at these conferences, and many times they have a large patient base. And by providing them with high quality patient educational material kits with a joint letter, it's a great way for them to not just give service or equipment, but also to extend the benefit of letting patients know that there's a way that they can improve their understanding of healthcare by distributing the COPD Foundation educational materials. And then the last two pieces we have here are publications by the COPD Foundation. First up is the COPD Digest. We distribute about 150,000 issues on a quarterly basis. The limit of ordering through the catalogs will be a limit of 500. These are ordered in quantity of each. If you would like to subscribe for the COPD Digest, there are multiple ways to do so: by calling our COPD information line, by going to the website located here at the bottom, or by using one of those tear-off pads that we talked about earlier. Next up is the Lung Health Professional magazine. This is a magazine distributed on a quarterly basis. The limit quantity order is 500 and the unit of measure is each. Our distribution is currently about 20,000 issues per quarter, and they go directly to healthcare professional audience. If you would like to subscribe for the Lung Health Professional, you may do so by going to this link at the bottom of the page. I'd like to thank you very much for joining today, and to remind you that the table of contents button is at the lower right hand corner of the educational video. In the future, if you'd like to return to this tutorial and go directly to a certain table of content item, you can quickly and easily learn about that specific educational material produced by the COPD Foundation. I want to thank you very much, and remember to take action today so you can breathe better tomorrow.